Hello, this is John Griffith, Clinical Education Specialist for American Medical Response in Southwest Washington. And today we're going to learn about the Pulsara app. You'll start off by entering your unit's username and password. In this instance, we're going to start with Medic1601. And our password is going to be EPCR for AMR. We can go ahead and get started. Once logged into the system as a medic unit, we're going to select our team members from the drop-down list. As you can see here, we have a few people already built. Today it'll be Jeff Bissett and myself, John Griffith. Go ahead and hit continue. Next, you see we come to the home screen where we can choose to build new cases, or in the instance of a unit getting into service, Pulsara is now activated and we can go about our regular daily business. So if you want to X out of the software, simply X out. Here you are, see a regular image of a smart device. To get back into the system, you now have a PIN number to enter, which has been pre-identified. In this case, the PIN is going to be 1, 2, 3, and 4, which will bring us back to the home screen. To create a new case, we're going to go ahead and select the New button. And in this case, it'll be a STEMI. However, PCell Southwest Washington will accept STEMI, stroke, and all general patients through the Pulsara application. That also includes trauma patients. In this case, we're going to select a STEMI. We need to select our hospital. In this case, PCell Southwest Washington Medical Center. The app patient side time automatically comes up to the default of the current time that you select the new case. So if that is indeed the time you're at patient side, go ahead and select Done. Items that you'll need to enter for the system to successfully transmit are going to be identified by shaded red and a triangle surrounding an exclamation point, as you see here. You see most of the data points are not required. However, scene departure as a time and the ETA time are required. These are going to be automatically set when you identify the scene departure, as well as the distance based on Google. Patient first and last name is also required. And that's basically it to instigate a STEMI, stroke, or general medical patient. However, we would encourage you to include additional information. Data entry within the program is relatively straightforward. You can type, and in some cases, you can also identify a voice dictation. So for the patient's first name, in these test scenarios, every patient's name will be identified as a test. Patient's age is going to be 35. Gender, there's only 2 gender categories available to us at this time, male and female. Height is in feet and inches. Weight, entering in kilograms, automatically converts to pounds. And images that are captured within the Pulsara app are kept within the app, and they are not shared with your device's photo library. They're not retained on the device whatsoever. So images that we would advise that you include would be a patient's driver's license, if obtainable, pictures of a EKG strip or multiple EKG strips if you determine this patient to be a STEMI, and then additional scene notes or field notations such as a medication list or the pre-hospital EMS worksheet that is often created on medical cases. In order to capture these images, it's relatively straightforward. You select the Capture Image button, your camera pops up. Here we have Mr. McLovin's driver's license. We'll use that photo. We also have an EKG. We're going to use this photo. and a field worksheet. We now have 3 photos attached to this case. We're going to go ahead and click back, and our images / EKG is identified with a 3 bubble, meaning that there's 3 images attached. If we were to select the contacts, we could go ahead and institute patient contacts for significant others, reporting parties, powers of attorney, etc. The application will also allow you to contact these people from the device within the software if you so choose. However, this is not a required field. Next, we can go ahead and enter the patient's vital signs. These are going to be vitals that you obtain in the field. You can see they cover the range of vital signs that we would normally include. This does not calculate the just GCS score for you. You'll have to do that. And then we can also edit the time. Once again, that scrolling screen will pop up if you want to select a different time. We'll go ahead and hit save. So we'll save our vital signs, as you can see displayed on the screen right now currently. Labs that are going to be relevant to us are going to be the glucose. Patient's glucose may be included based on either a finger stick or an IV start. Patient's glucose, in this case, we're going to say it's 96. You can see the other values for labs, while there's areas to include data, are not relevant for the pre-hospital. Once again, we could also adjust the time as necessary. We've entered the data, we're going to hit save. This will bring us back to the general patient screen. You can see all the data has been captured here, available for review. We can then select the alert button. What the alert button will do is it'll notify the receiving base station of an active case inbound to the facility and notify the rest of the team of such case. If you wanted to review data you have included thus far, simply drag the screen up or down based on the orientation of your phone or your iDevice, and you can go ahead and see we didn't include seat departure time. Defaults to 1:46, that's the current time. We'll go ahead and select done. Being that this is a recording very close to Southwest, gives us an ETA of approximately 3 minutes, roughly 0 miles. It's actually about a mile. Once I go ahead and select alert, this will notify the hospital of an incoming patient. Patient registered successfully. At the bottom of the screen here, we see 3 pieces of information. First contact was approximately 6 minutes, 45 seconds ago. Time to door is at 0 because the patient has not arrived yet. And then we have this little bubble here that we can select to add additional notes. This is just like a text message that you would add text to in order to text one of your contacts on your regular phone. However, this goes directly to the base station receiving facility and or charge nurse who is monitoring the system. So if we were to add a message here, we can do a free text, we can do an arrive at destination, we could also do an EKG. In the future, these standard canned messages may change. However, you're always available to free text. Free text will include a text keyboard, or you can voice dictate your message. We have sent the message off. If we have any additional data that we can include, we could enter this as well. So maybe an interpretation of an EKG. Additional treatments have been rendered and sent to the receiving station. If you have no other messages to send, you can go ahead and click back. And now the information you see, and in this case, the STEMI has been canceled. Push messages will come up from time to time in cases. These messages are created by the system organically as a result of input received at the base station. So if this case, the STEMI case was canceled, we received the push message that says case was canceled. Other messages could include patient interventions such as balloon or surgical interventions for STEMI and stroke to notify you that the patient has received treatment. So you can see as we scroll through here, the receiving hospital has the ability to add additional data to the case for their internal use that you would be aware of. Once again, once images have been captured in the software, they are retained on the software and not on the device itself, the phone or the iPad. Employees who are associated with a certain case or patient transport should not be able to see transports created by other users. And please do not adjust settings within the preferences page. If you have any questions, please contact myself or your on-duty supervisor. Thank you very much.